This sounds like a huge question to me, but what are the treatments that improve mental health and do they work?
In terms of homeless populations.
Yeah,
Yeah, I guess it's a good follow on for what I was just saying. Uh, Generally speaking, there's a lot of the same treatments that would apply to anyone can be effective for people that experienced homelessness, because ultimately people that have experienced homelessness are people, and we know these interventions work for people. But it's more complicated than that. I'm being slightly facetious. Is It's, if a person's hungry and lightheaded and exhausted because they had to stay up all night because they were in an unsafe environment, CBT is not going to do a lot. There are a set of conditions upon which our standard interventions are understood to work. Things like psychotherapy, various psychosocial interventions, medications, these sorts of things. The premise is that there are other conditions met to make those things work, to make them improve that person's life, make them feel better in mind and body, and more able to do stuff that they want to do. Fundamentally, what's needed to address mental health challenges for people experiencing homelessness, again, that diversity caveat is there, it's not one size fits all, is you need what might be called a complex intervention by some. You need to do quite a few different things at once. So one thing is stabilizing, making sure a person has enough to eat, that they have an opportunity to have an okay sleep, to have some social contacts that are safe. I mean, these kind of really, and having shelter obviously is having, things like Housing First, for example, is providing shelter in a fairly timely manner without a whole bunch of requirements, where a person can just get that stability. These are some fundamental, like it's almost like the foundation, I think, that needs to be laid for many people. Then you can move on, and not to say that it needs to be, okay, you need to do A, B, and C. Sometimes I think you can do a couple of things at once, but you need these foundational pieces, I think, there, that then you can move on to a deeper dives in areas such as, very psychosocial interventions, supported employment, cognitive behavioral therapy, addressing trauma, for example, psychotherapy for trauma, addressing addictions through various evidence-based means, and there's the whole range of interventions that then apply. And then backing up a little bit too, don't want to give the impression that you need to get housing and food and all these things before you can do anything else. Well, I think early conversations can happen at any time, where it can be talking a little bit about some of the skills, some things a person can be doing. And as well, again, across the board, not one answer is the same for everyone, but there are some folks that the path with some specific mental health challenges, that medical treatment is an important first step, that a person, they might not feel like they're able to or can access some of these other foundational pieces, as I've called them, until some really challenging symptoms and mental health challenges can settle down enough that they can feel like they can engage in some other things. So, these are some of the kind of the spectrum of things to think about. And I think, on the front end is again, it's not one size fits all, is a careful assessment as to what does this person need? Is this a person that they need some safety, some food, some shelter before we can start other things? Or is this a person that we need to start talking about some other pieces first and then weave the others in? And, and then fundamentally, where we're hamstrung, we have a lot of evidence for many different interventions. We're less good at understanding algorithms. It's like if in physical medicine, physicians use algorithms a lot. So you turn up at the hospital, you got a bad burn on your arm, for example. There's an emergency response, and then they assess and figure out with A, B, and C options in terms of intervention and medication. Okay, you're a person who needs to go to A, and then next you need to go over here to get some rehab, and then there's a follow-up option here. It's like a sequence based on an assessment at each time point. Is we're not that good at having evidence behind those sequences for people such as people experiencing homelessness. And the fundamental thing I'm driving at here is funding. This sector, the mental health sector as it relates to homelessness, is profoundly underfunded. We often know what we should be doing, what we can do and what works. we just can't do it. We don't have enough people to do the assessments, to do the treatments, to do these sequences I'm talking about, to have people fall off, as will happen, and pick up again where they've fallen off and restart where the fit is. Like all of these things, access to housing, it is a rate limiter. I mentioned access to housing as being fundamental. That's a fundamental that is out of reach for far too many people. And we miss so many opportunities, and people lose so much time in their lives because we can't provide that. So I think there are far, far more effective ways of doing things. And we're often left scrambling, but it is worth mentioning that ultimately funding really influences what we can offer and its effectiveness.